Okay, hello there and welcome to Generation Exceptional. I think this is episode 24 or 25. There aren't that many episodes. I should really know the number. I should probably have gone and checked first, but I didn't. It doesn't really matter what number episode it is. I'm joined today by Dr. Ruth Briant-Jones. Ruth is a medical doctor and now a functional medical doctor, and I'm really keen to explore what that actually means. It's a term that I keep hearing, and I'm not fully certain of exactly what a functional medicine doctor is. So, Ruth, welcome to the show.
Thank you, Bev.
You're very, very welcome. Ruth, just give us an introduction to who you are. I know you're a doctor, but you've had a career before becoming a functional medicine doctor. Can you just give us a bit of a brief background into how you ended up where you are now?
Okay, I'll be as brief as I can. So I started life as a PE teacher, and I very quickly realised I didn't want to do that, and I joined the Air Force. I worked in training and development for 5 years, and then after a deployment decided that there was more to life, and I left to go to medical school and trained as a doctor, which I qualified a few years ago, 4 years ago now. I spent some time in the Air Force as a doctor, and then took the plunge last year to change career course within medicine to becoming a functional medicine doctor.
Okay, that was very brief, but that's a lot of things for somebody who's still quite young. You're only in your early 30s, aren't you?
I am.
Okay, so you went from a PE teacher to, was that a trainer in the Air Force?
No, so I was a PE teacher, and then I was a training and development officer. Yeah. In the Air Force.
So you went from teaching kids to teaching more kids?
Yes, grown-up kids.
Grown-up kids. And then the pivot into the medical world. So, and then I take it you came back into the Air Force as an Air Force doctor?
That's right, yeah.
Yeah. Okay. But there's personal trainer in there somewhere, if I remember rightly, is there not?
Yes, yeah, I did. So while I was trained to be a PE teacher at uni first time round, I did my fitness instructing qualification and did it as a job on the side. And then when I left the Air Force as a training and development officer, I realised I was probably going to need some income through medical school. So I trained as a personal trainer as well, and I did some personal training work throughout medical school.
Fantastic. That's a very broad background of experience.
Yeah, I'm interested in lots of things.
So what caught my eye, Ruth, is we have a mutual friend, and she's talked very highly of you. And she shared something. She shared something on Facebook, a blog that you'd written about managing menopause the functional medicine way, and I had a read of it, and I really liked it. It seemed to fit very much with my own philosophy on how we should be managing menopause. Before we came on air, I asked you, where your interest in menopause came from with somebody so young. And if you just want to tell us a bit more about where that interest in that particular area came from.
Yeah, so I see a lot of people, and what I noticed was that I was seeing a lot of women in their 40s and 50s who were suffering with symptoms of menopause or perimenopause, and I noticed that they weren't necessarily getting all the help they needed from conventional medicine, hence why they were knocking on my door. And I realised that there was probably a lot of people out there who were in a similar position, and it would be a good idea to put some of that information out there onto the internet to show women that there's a different way to manage menopause beyond medication.
Yeah. Now, this brings me into the big question here. Why, or how rather, does functional medicine differ from traditional conventional medicine? What's the basic philosophy that is different about functional medicine?
So conventional medicine is very disease orientated. So you come in with a symptom, you're given something to fix the symptom, and that's pretty much what we do. It's a very process system, which is very efficient, and it works well within reason if you're looking to manage symptoms. The way that functional medicine differs is that it takes a much more holistic approach and is person-centered. So instead of a symptom coming to be dealt with, it is a person who is coming with a range of symptoms potentially. And it's about understanding where those symptoms come from, and also understanding that lifestyle plays a huge part in those symptoms, and that you can't, a pill doesn't stop the problem. It masks it.
Yeah, it's like putting a sticky plaster over the top of it, isn't it?
Exactly, that's exactly it. And that means that the problem goes away and we forget about it, but we don't necessarily change the warning sign that it is. And that can then lead on to further problems. And you find that you put somebody on one medication, and the next year they'll be on another one, and then before you know it, I'm on an A&E shift seeing somebody who's taking 15 medications, and that's no way to deal with people. Functional medicine looks to treat the underlying cause, and to focus on the whole person to ensure that they're preventing those problems happening in the future.
Now, I can see why this isn't necessarily mainstream traditional medical practice when you consider that most GPs get, 10 minutes with their patients. I'm guessing the most they can probably hope to do in that 10 minutes is to put a sticking plaster on, identify the problem and put a sticking plaster on it. So do we have functional medical practitioners within the NHS, or are they all private?
As far as I'm aware, there are people who work within the NHS, for example, as GPs, who have had functional medicine training, but they are not employed as functional medicine practitioners. They are often the weird ones, who who their colleagues may well refer complex cases to, or whatever, but there is certainly nobody directly employed by the NHS as a functional medicine practitioner. It's very much a go it alone.
So what was your reason for sort of moving away from conventional medicine and heading more towards the functional medicine? Was there something that triggered that, or just a natural
I wouldn't say I wouldn't say there was one triggering event. I think because I went into medicine late, and with my exercise background, I've always been interested in nutrition and lifestyle and all that stuff. And when I went to medical school, I was actually a bit disappointed in the way that we were taught, which was very reactive. You deal with the fire when it's there, as opposed to trying to prevent the fire happening. And I kind of had this nagging feeling all the way through medical school that this approach wasn't necessarily going to be right for me. And when I got into practicing as a doctor, that was completely emphasized to me, that our approach was wrong. We didn't have time. And a lot of the people that I worked with, colleagues, felt the same, and they still feel the same. People go into medicine generally because they want to help their patients. And I was getting more and more frustrated at the time constraints, and the lack of interest in the underpinning factors that affect our health. What we eat, how we move, how stressed we are. All of that stuff is so important, and it's totally ignored, or at best written into an advice leaflet and shoved in the last minute, towards a patient. There you go, crack on. And that clearly doesn't work, given the amount of problems there are, and that people are having with maintaining their health. And I started GP training in the Air Force, and for two reasons I left. One was I have a young daughter, and I wanted to be close to her. But the other, and that's about quality of life, and that's an important thing as well for everyone. And the other was that I just didn't feel like this conventional system was right, and that it was working for the patients that I want to serve. So that was that was why I made the switch.
Yeah, it almost sounds as though conventional medicine almost perpetuates illness to an extent. Is that fair?
Uh, I think conventional medicine absolutely has its place. There is the treatment that is there, the NHS that we have in the UK is amazing, but the resources it has, what it produces, is amazing. And medication certainly has its place, but I think there is more that we can do as individuals um, to preserve our own health. And I feel that it should be more of a partnership. So I don't think the conventional approach necessarily perpetuates ill health, but I think it has taken so much responsibility in that kind of traditional uh, sense, the autocratic way that medicine used to be, of the doctor telling the patient what to do. I think that's at odds with good health, with creating good health, which is about partnership.
Yeah.
And encouraging people to take responsibility for their own health at the same time.
I agree with you totally. That's a massive part of health. I think we're very it's many of us assume that the doctor can wave a magic wand and put us right. And I have to say, I'm probably in the past been guilty of this. I remember, probably about 15 years ago, maybe a bit more, having a sports injury and going to a physiotherapist and lying on the physio's table and getting some ultrasound and some massage and walking away thinking I must be fixed.
Yeah.
Despite the fact that he'd given me, quite a few exercises that I had to go and do on my own that I didn't do. And 2 weeks later, I'm thinking, well, I've still got the problem. Well, he must be no good then because he hasn't fixed it. Instead of actually taking responsibility for that partnership, exactly as you say, I wonder maybe if the very fact that we are very fortunate in this country to have an NHS that is always there to pick up, to be there for us, if we've almost become too reliant on it to be a magic wand to fix us.
Yeah, absolutely. And the amount of consultations I've had in the past where someone's come in and they've been just angry or disappointed when I've not given them a prescription, and that culture needs to change, because I think there's a certain lack of understanding that often you give somebody a medication, there's probably going to be a side effect, and then you might need to have a medication for the side effect, and that cycle just keeps repeating. If we can avoid putting extra things into our body that we don't necessarily need, that we can address through our own actions, then that's the perfect way to address things.
But of course, that's not a quick fix, is it? That takes effort, and that takes time, and that takes commitment and discipline. And we live in this very sort of quick fix, all or nothing society now, which is quite at odds with the whole lifestyle adjustment philosophy that I certainly try to live by.
Yeah.
Let's be honest about this.
Try to live by, yeah.
So one of the questions that came up, I shared your blog on menopause in my Facebook group, and one of the questions that came up, or a comment that came up, was, well, isn't this just the same as lifestyle medicine? And they were talking about functional medicine. And I didn't really know the difference. I took a stab at what I thought the difference was. And then another member had a chat with you, I think, and gave it a nice explanation. Can you give me your take now on what the difference between functional medicine and lifestyle medicine is? Because they do sound very similar.
Yeah, and they are very similar. They're both, kind of emerging healthcare approaches. Functional medicine has taken off hugely in the US, and they have another style of medicine called integrative medicine, which is also big in the US. And what I'd say is that integrative and lifestyle medicine are pretty much the same thing. Functional medicine is slightly different. So lifestyle medicine looks at all the lifestyle factors that affect health. So these are the kind of things we've already touched on. So exercise, stress, sleep. nutrition, and the mindset stuff as well. So talks about connection, how we, our faith or our connection with the world around us. And those are the kind of pillars that you focus on when people come in. So somebody might come in and say they've been to the GP and they've been told they've got high cholesterol, and they've been told they need a statin, but they don't want the statin. And is there a way that we can deal with that? So a lifestyle medicine consultation would be saying, okay, what's your life like? What do we know about cholesterol? What can we do to address that through your lifestyle? And that's pretty much it. But it's a holistic look at the individual, and it's trying to use all of those kind of 5 pillars to support that and to avoid that person needing medication. Maybe it's not, it's never a guarantee, and I would never dissuade someone to not take medication if they didn't need it. The functional medicine approach is that plus. So it's the underpinning, way that we deal with things in functional medicine are those 5 pillars. But what we're trying to do is to get beyond the high cholesterol and figure out why. So instead of just looking at the diet itself, it's looking, are the genetic factors that are at the root cause of this high cholesterol? Is there a gut issue with absorption? Is there a problem with your, with your bile tract? Are all of these things, it's trying to find the reason behind it and then addressing that. So it's lifestyle, but it involves detective work to get to that.
Okay. So as a health coach, I would, exactly as the pillars that you're talking about, I use a framework called NEST, which covers exactly as you said, nutrition, exercise, sleep, stress, thoughts, feelings, the whole sort of mind-body connection bit. Now, I obviously don't have a medical background, so I wouldn't necessarily be able to, I may be able to recognize if somebody has gut issues, but I wouldn't have the knowledge or the skill to be able to do that investigative work. So I'm guessing that's where I would then be able to refer a client on to somebody like yourself, who would then maybe do some clinical tests, maybe that sort of thing. Is that
absolutely?
Functional medicine takes over from the
So it's about trying to find, as I said, the kind of root cause, the upstream cause of the symptoms. So somebody can present with a whole cluster of symptoms in different systems. So again, a conventional approach would, oh, you've got a problem with your skin, I'll give you some cream for that. And oh, your thyroid's not working properly, I'll give you some thyroid replacement for that. Whereas a functional medicine doctor would look at all of those symptoms together and say, is there a unifying cause of that? Is this actually more to do with something in the background about the way that you process selenium? Have you got what we call a SNP, a polymorphism that's causing this problem? We need to look into that, and that's it. By trying to deal with things at that level, you are then covering all of those symptoms simultaneously. So it expands beyond the one system approach. So you don't have to see a dermatologist and then an endocrinologist and then a gastroenterologist. You are seeing somebody who's trying to cover all of those at once.
Yeah, fantastic. So what do you find is the biggest resistance from clients to making those changes? We've talked about responsibility before, and I think without, obviously I don't have your clinical knowledge, I can't go into the depth that you do, but I understand the lifestyle factors, I suppose. And the reality is, I think most of us know what we should be doing. It's not rocket science. That you eat a diet predominantly whole foods, it's going to be better for you than if you eat predominantly processed foods. I think that's fairly common knowledge. But knowing something and actually implementing it and doing it are very, very different things. So, how do you encourage your clients to actually make the changes and take the responsibility that they need to take? And what's the biggest resistance do you think you get to making the changes?
So I think, starting with the resistance thing, I think the thing that gets sort of thrown back at me often is, oh, I don't have time.
Oh, yes.
Yeah, I don't have time to make all these changes, or this list of food, where do I get all of this? And often this list of food is a list of fruit and vegetables. It's really not, we're not talking Himalayan salt or, you know, any of the other stuff. It is pretty basic. But kind of getting to that basic unprocessed stuff is actually more difficult than you might think. You know, you've probably got about 2 aisles out of the supermarket to choose from. And culturally, it's quite difficult to fit all of that in when you're going out for dinner with friends, or you're eating around people who are completely absorbed in our culture, as everyone is really. So there is generally a kind of resistance along the lines of, I don't have time to learn this new way of doing things. I don't have time to prepare this food in a different way. And I don't have the energy to fight my family all the time about this. So often, in terms of sort of working with people, I talk about motivation. So it's very easy to give people information. And like I said earlier, you can give people advice, and it's on the internet, and it's everywhere. People know the basics of what they need to do, but actually the key is figuring out why they want to do it. And that's about getting behind. So often people will come to me with their menopausal symptoms or whatever, and the main thing they're concerned about is weight gain. And they'll say, I just want to lose weight. You know, that's all I want to do. I just want to lose weight. And I'll say to them, that's fine, but why do you want to lose weight? And well, because I'll feel better. But why don't you feel good now? Because, you know, we're not having to wheel you through the door here. You're still functioning pretty well. And it often it will boil down to they're not happy for whatever reason. And that's probably a more useful starting point than dealing with all of the kind of surface stuff of eat more carrots and less cake.
Yeah.
You know, and actually working with people beyond the medical advice to get to the root cause in a functional medicine kind of way, but talking about mindset of why they're not happy, and working to fix that first, to get to them a point of them finding the motivation they need to be where they need to be.
It's really interesting you say that, because I find the majority of my clients come to me initially for weight loss, and almost without fail within the first session, it's never ever about weight. That always becomes secondary. It's always deeper than that. It's generally high stress or poor sleep, or, you know, they don't have a great sense of purpose. They feel they've lost their sense of purpose, and they're focusing. And I know this because I did exactly the same thing. This is where my sort of change in career all happened, was because I started thinking I just need to lose weight. And when that didn't fix the mindset, I thought, well, I've got to look somewhere else. It's obviously not superficial. You know, not all weight loss is superficial. There are some people that are, you know, grossly overweight that is affecting their health. But I think for many of us, our weight issues aren't really health related issues. They're far more about self-esteem issues.
Absolutely.
And getting to the crux of why the self-esteem is lacking. I find it fascinating. So who do you find the majority of your clients are? Do you work to one particular demographic, or do you tend to attract a certain type of client?
I have to say, I would have said you know, a few months ago that I definitely attracted a certain type of client, which is women in their 40s and 50s. You know, I think because of all the hormonal changes that are going on for women, suddenly health doesn't feel as secure anymore, and lots of things start feeling wrong, and hormones can do that. You know, they affect all the systems, so it suddenly feels like everything's gone wrong altogether. And you know, you throw lack of sleep and irregular periods and weight gain and all the rest of it that comes with that, and it becomes quite confusing and scary, and conventional medicine doesn't always know the answer to that, and may well throw an antidepressant their way. which for many doesn't sit right. And I think, you know, that seemed to be the people who were coming to see me, and they still do. But I have seen quite a broad range now. You know, guys who travel a lot who think they might well be having an ongoing gut problem that it just isn't getting fixed in normal medicine, or very, very young people who've had, you know, anxiety and depression for, since they were 12, and, you know, come to me at the age of 19 thinking there has to be a better way than antidepressants or whatever else. So actually the demographic appears to be broadening. So I haven't specialised at this point. I'm seeing everyone. There may be a point that I specialise, but at the moment, I see a really broad range of people.
Would you say that you found any one of those pillars that we talked about before to be more predominant, a trigger in sort of health related problems? We talk about we are what we eat, which would suggest that it's all about the nutrition. Then other people say, you know, you've got to keep moving. It's all about keeping the body mobile and moving a lot. Do you think there's any particular one of those pillars that is more prevalent, a trigger for ill health?
I think that is so dependent on the demographic that I'm dealing with. So I would say for lots of people who are coming with chronic sort of autoimmune issues, joint pains and things like that, their nutrition is massive, absolutely massive. It plays a big part in everybody I see, but because of this, you know, culture that I talked about, we just live on processed food and sugar and adrenaline. That's about it. But yeah, certainly for those with chronic medical conditions, diet plays a big factor. For women who are coming with menopausal symptoms, actually stress is one of the biggest factors. And often the women that I speak to are really conscious about their diet, and they may not be perfect, who is, but there are certainly nearly always tweaks that I can offer and supplements that I can recommend and everything else, but a lot of it boils down to the ones that have the worst symptoms are the ones who are firing on all cylinders all the time, who are managing work life, home life, social life. They're just throwing everything they've got at everything around them and spending no time on themselves.
Yeah, it's strange actually. I find a few of the clients that I've spoken to when we've been having sort of the coaching sessions, I've said, you know, do you think you're stressed? And they say, no, I'm not stressed. I'm busy, feel a bit overwhelmed at times. I wake up with anxiety and I have the odd panic attack, but no, I don't think I'm stressed. And I think we do tend to think of stress as acute stress. You know, we think of the feelings of acute stress, and actually acute stress isn't really the problem, is it? It's that low level chronic, constant, almost sort of a rusting away of our inside type stress that people don't even, they're so used to it, they don't even realize that they're carrying it.
So true.
Yeah. So what are the effects then? Let's get to your doctor knowledge here. What are the effects of chronic stress on the body? Why is it such a risk factor?
So in terms, well, of longevity, so chronic stress works your adrenal, glands very hard to produce cortisol, which is the stress hormone, which is fantastic. It's a fight or flight, you know, type hormone, and it's great if you're running away from the, you know, the saber-toothed tiger, that classic analogy. But when you're exposed to it over a long time, you can end up, first of all, with a higher cortisol level, and then over time your adrenals can get really fatigued, and it ends up really low. So you can be with a high cortisol level, just in a constant state of anxiety and pressure and unable to sleep and all the rest of the stuff that comes with cortisol. That also affects the way that you manage your blood sugars. So you can then develop what we call a metabolic syndrome, which can lead on to obesity and diabetes and cancer and all the rest of it. But you can also get to this low cortisol stage where your adrenals are burned out and you are just wiped, completely wiped. No energy, unable to get out of bed, unable to go to work, just completely fatigued to the point almost of no return. And that's a pretty serious state to get to. That's a kind of chronic fatigue syndrome type state, and that's pretty hard to get out of.
Is ME an adrenal fatigue condition?
Yeah, I mean, adrenal fatigue, again, that's a bit of a controversial term. Conventional medicine doesn't necessarily recognize it, but in our world, yes. ME is some people might call it the old term for chronic fatigue syndrome. We're still unclear on the cause of it, of why people develop it, but the theory certainly in functional medicine is that it's a condition of adrenal fatigue that may have been sparked by an infection or any other kind of life event, really.
And do you find that sort of this chronic stress situation that leads to the sort of the low energy and poor sleep and all the rest of it, is that something that tends to be so gradual in its onset that we don't even recognize it, or does it tend to come on does it hit people quite hard? How does it sort of manifest?
So it depends on the individual. I mean, often the kind of individual I've seen with chronic fatigue certainly tend to be the go-getters, the high flyers, the people who are doing triathlons for fun every other weekend, and just push hard at work, push hard at home, and then the balance, they kind of manage to maintain that for a long time, and then for some reason the balance gets tipped off. And it's funny, it's not funny at all, but the people that I've spoken to who've had that balance tipped off, seems to be some kind of stressful life event that does it. A loved one being diagnosed with cancer, a redundancy. It's something very stressful that suddenly tilts the balance, and they find suddenly, and it does seem to be sudden, that they've lost all their energy, and they feel depressed and demotivated, uninterested in anything around them, and unable to concentrate. They kind of develop this brain fog, and it is very noticeable.
Yeah, I wonder, have you ever seen the Yerkes-Dodson stress curve?
Yes.
There's that sort of point of optimal stress, which is actually quite high, which is great. You can perform really well at that optimal sort of peak of the curve, but if that's maintained for any length of time, it becomes, your performance drops as the stress sort of rises. I wonder if that's what's happening. They're maintaining great stress levels that are motivating them, but something tips that balance, something comes along that they've not anticipated, and their performance drops, but the stress still goes up.
Yeah, I mean, I think that's that's a kind of microcosmic example in terms of, the performance curve is about a very discrete point in time, when you're in an event. In terms of life, you don't want to be at that hyper performance or that optimal performance level at all times.
No,
funnily enough, you will burn out.
Yeah.
But yes, it's I guess that's a microcosmic example. That is pretty much, you're operating at this level, but actually what might be happening is that you're operating at this level, but burning supplies gradually as you go along, to the point where you just haven't got them anymore. That's not a peak performance level that's sustainable. It never is. So there will always be a point where you just can't sustain it.
So there's a high flyers, but I see a lot of women who wouldn't probably class themselves as high flyers, but they're just constantly busy. They've got older parents they're having to care for, they're feeling responsible for, maybe even a bit of guilt thrown in there. They may still have young children, women having children later on, so they're going through the hormonal, the chemical changes in their body through menopause, but they're probably still not that not that long since giving birth, maybe 4 or 5 years since giving birth, and they've got all that, plus the pressures of children, or maybe they've got grown-up children that are still sort of dependent on them, even though by society rights they should have moved on, and they're still dependent. So they've got all of this stuff going on, but they wouldn't necessarily call themselves high flyers, which I think is why they don't see their that they're stressed. They just see this as, you know, life that they have to get on with. How does that tend to grow gradually then? That the stress, I'm still talking chronic stress.
I wouldn't say that that's a, you know, I would have put them in exactly the same category as a high flyer. It's the same category. You know, you might not be, again, in the conventional sense, in a high you know, high level role at work or whatever, but if you are putting in the level of intensity in all parts of your life, then you're suffering exactly the same. You know, you don't have to be scoring on Mensa and doing all the rest of it, and winning accolades to be somebody who's at risk of chronic stress. If you are stretched in all directions and on the go constantly, you're going to be suffering with chronic stress, particularly if you're not giving yourself the time to offload, to recharge, to look after yourself. And that's a biggie for lots of women in particular.
Yeah, so we've got the sort of social impact, we've got the environmental impact, we've got the physical changes that are happening. I'm talking specifically for sort of women over 40, my sort of demographic, if you like. So what is the impact of that sort of low level raised cortisol on the sort of sex hormones as we go through menopause? Is there a direct correlation between an increase in cortisol and an imbalance in things like estrogen, progesterone, and the other sort of fertility hormones?
There is always, because there is a cascade in terms of how your sex hormones are made. In fact, all of your hormones are made. Because cortisol, so we all need cortisol. It's not the devil hormone. It is something we require to get us up in the morning. We get a spike of cortisol when as we wake up. It's the thing that gets our body going and active. And because we need it to live, it's the thing that is prioritized on that cascade. So when we are told by our brain that we need cortisol, that is the number one thing that gets produced. That is when we have the resources in our body, it goes to cortisol. When we've got enough cortisol, we start moving down the cascade and we make sex hormones. Sex hormones come somewhere along the end of the line, because we don't necessarily need them to be alive immediately, although they're pretty useful. But what that means is that when we have a higher demand for cortisol, all of our resources are used in making cortisol and not in the sex hormones. So you can become deficient in progesterone and testosterone and estrogen simply from being stressed. So it has a massive impact. So
that would suggest then, if we can, because one of the things I've seen anecdotally, I don't have any sort of science backing for this, but one of the things that I've seen anecdotally is that the women that I find that come to me with very high level of perimenopausal symptoms, that was bad English, follow me with this, with fairly severe symptoms, tend to be naturally quite high anxiety levels, quite high stress levels, which seems to me that there must be a direct link between high levels of stress and increased perimenopausal symptoms. Is there science behind that? I that's something that I've observed, but what you're saying would suggest that could be a direct link.
Yeah, there is some behind that. There's certainly, there's been some studies looking at cortisol levels and hormonal response and perimenopausal symptoms, and there is a link. I wouldn't say it's gold standard evidence. I don't think we study women enough, and there's a reason for that. I recently found out that we don't do studies on lots of women because the hormone levels change their responses at different times of the month, so it doesn't make for good scientific studies because we're not consistent enough. That's crazy, isn't it?
Yeah.
All of the data we've got, or the vast majority of the data we've got, is based on men, on, the medications we take are based on the male system, not on the female system. So yeah, there is some evidence, but we don't have enough. And in the functional medicine world, we're convinced enough to think that cortisol is definitely linked. And even on the standard advice leaflets, the advice is that we manage stress, although we don't talk so much about cortisol.
So how do we manage stress? What would be your top tips to a client or a patient coming in, saying, look, I've got chronic stress, I haven't got time to do all these things you're telling me. Give me 2 or 3 things I can do to get my stress levels down. No pressure.
Yeah, no pressure. And do it in the next minute, because
I'll do it in the next minute.
Yeah, I mean, I recommend some quiet time, and I know that sounds silly, and the amount of in fact, I wrote a blog about it this week. The amount of conversations I've had with people to say, right, let's have a look at your schedule. Let's find some time, and they'll just sort of look at me and say, I haven't got any. I've got no time. I'm planned up to the time I go to bed, and then I get up at 5 o'clock in the morning to fit in everything I've got to do before I go to work. And actually, it is more about prioritizing. So you need to look at the schedule and think about what your priority is. So I've worked with people well, on Saturdays I spend my day doing the washing and the ironing, and then I've got to take the kids to gymnastics, and and we kind of, I've worked out with them, do you need to do that much washing all the time, or can you maybe delegate that to your husband? Or but actually working with people to give them time, just time to do something for themselves, self-care, self-love, just spending some time. Often it's a bath on a Sunday night as a decompression, or rekindling your love for netball, or going and doing something for yourself that isn't for anyone else but yourself. Just finding that recharge time.
Yeah, I read, I don't know if you've read any Brené Brown. She talks about having playtime. And I really like the way she describes playtime. She talks to to somebody who said, she said, how do you spend your playtime? She said, I love playing with my grandchildren. And she said, okay, so do you kind of love playing with your grandchildren, but you're kind of glad when it ends so you can have a rest? She said, oh yeah. She says, that's not playtime. Playtime, that's children time. Playtime is when you're doing something for you that you can get lost in, and the time will fly and you don't want it to end. That's playtime. And for me, that's playing an Irish drum. That's my playtime.
Fantastic.
And that's, that is I get absorbed. It must be horrendous for everybody else because I'm not very good. But that's me. That's my playtime. And I think that probably not quiet time, but it's that break from the constant mind chatter, the constant, what have I got to do next? What should I be doing? What do I need to do? That's my break. That's my quiet, noisy time.
Yeah, it's that kind of, it's that disconnection from all of your obligations and everything else. It's investing some time in yourself to just be, to just enjoy that moment. And again, it's stressing that you don't sit in that moment and say, I need to feel really good at the end of this. I've got half an hour left and I'm not feeling good yet, so can we just focus on feeling good now? Because people do that. But it's actually doing something that you love so much that you are in it and you're present and you're feeling it, and when you end it, you feel revived and recharged and happy.
It's difficult though, isn't it, to try and get people to realize that that's an important bit of time. It's not wasted time. It's because I talk to people and they say, yeah, I could do that, but I'd be spending the whole half hour feeling guilty that I should be doing something else. No. This is it's exactly as you said before. It's a priority. It's it's another job. I don't like to put it like that because that puts pressure on it, but it's something. It's a high priority to factor into your day. It's not wasted. selfish time.
Yeah, I think I honestly believe that time is the foundation for who we are, for knowing ourselves. And without that, you lose yourself. You lose yourself in doing and doing it for everyone else.
Yeah.
And if you don't have that time to be who you are, to enjoy living, then you're not living.
No. And in some ways, it's, I jokingly, I say this tongue in cheek, but it's quite selfish not to be selfless. Because actually, if you're not in a great place, you're not much use to anybody else. You know, you're not, if you're burnt out and you're fighting fires the whole time and your temper's frayed and you're snapping at everybody around you because you can't cope with everything going on, then actually it's not great for everybody else. And if you've taken that half an hour of me time, of drumming or reading or bathing or whatever it might be, stops you being so snappy with everybody else. It's really not selfish at all, is it?
No, it isn't at all. And I find that the people who really struggle to calm, I will often sort of suggest to them, why don't you try one of the mindfulness apps, or that will take you through some of the steps to learn to let go a little bit, to relax, because I think some people just forget. You get so wrapped up in just being and surviving and making sure everything stays afloat that you sometimes forget that there is you in there somewhere. Learning to just calm down and see that, and enjoy that is so important to who we are.
This actually sort of comes full circle back to the functional lifestyle medicine versus conventional medicine, because I think, sometimes when you listen to the advice being given, it, in terms of lifestyle advice, it seems pretty simple, doesn't it? Just eat more fresh foods, move a little bit more, get a little bit of playtime, write your thoughts down. Maybe they're not, there's no long Latin chemical names. It's quite straightforward, and it's almost as if well, surely that can't work, that's way too simple. One of the things I try and advocate is just to stop and take a few deep breaths, and you think, well, it's not really going to, it's not sexy, it's not going to change it, it doesn't sound like it's going to rock somebody's world, but to me, I know if I feel anxiety and stress rising, just stopping and taking a few deep breaths calms me right down. And I know there is a physiological thing happening there, but as advice, it sounds too simple. Do you think maybe we're always looking for the complicated solution when actually the simple solutions are right there?
Yeah, I think that's 100% true, and I think that's why, to a certain extent, there's some resistance to functional medicine and lifestyle medicine from the medical fraternity, because it is very simple. It is dealing with the complexity of humans.
Yes.
And that's something that conventional medicine doesn't necessarily have time for. And there are some amazing specialists who work in their various fields, who can tell you everything there is to know about the kidney, or the liver, or the whatever, and they all have their place. But the simple stuff is where you make the changes for long-term health. These guys who are doing all the specialist complex work with the complex answers are saving lives. They're saving lives where they need to be saved. But in terms of dealing with people on a long-term basis, of safeguarding health and quality of life, for dampening down symptoms that don't need to be there, actually the simple advice is the best advice. But it's very difficult to put it into practice. And that's where you need the expertise, dealing with the complexity of human life. That's where we come in.
Yeah, I mean, certainly that's where I see the coaching side of things taking the next step from the GP. The GP can, even a conventional GP can can guide you, can give you the what to do, but they haven't got the time to help you implement the how you're going to do it.
Yes.
And I think often it's the how that is the difficult bit, because going back to what you were saying earlier about something as simple as, you know, eating more vegetables, well, for somebody who's never eaten fresh foods, they've suddenly potentially got to change where they shop, how they cook, learn to cook. You know, it's much more than go and eat 5 a day. That's a very simple bit of advice that could actually have a massive impact on somebody if they've never ever done anything like that. I mean, I was in the supermarket not long ago, and I picked up some lemons and a couple of limes, and if I can, I try not to put them in packaging. I'll just put them loose. And the young girl on the checkout knew what the lemons were, but she had to ask a friend on the next checkout, what are these green lemons? And her friend said, no, they're limes. And I thought, I mean, it made me smile at the time, but then I thought, actually, that's really, there's a little bit of something concerning there, that something as obvious as a lime, this young girl didn't know what it was. I found that quite, a bit funny at the time, but with a bit of reflection, I think, well, that's a bit of a sad reflection of our of our society, really, isn't it?
Yeah,
I'm totally off track here. Ruth, thank you so much.
No problem.
Fascinating talking to you, and thank you for clarifying in my mind the difference between functional and lifestyle medicine and how it differs from conventional medicine. Now, if people wanted to get in touch with you, how can they find you? Because I know you have you're a coach as well as a functional medicine doctor. So how can people get in touch with you?
Best way to get in touch with me is via my website, which is www.ruthbriant-jones, Bryant with an I, not a Y. ruthbriant-jones.com, and all of the details are on there.
Excellent. And are you on social media at all? Can people follow you?
I am. I've got a Facebook page, which is Dr Ruth Briant-Jones. I'm on Twitter, and I'm also on LinkedIn and Instagram too. So
fantastic. Well, I'll get all those links from you, and I'll put them into the notes for the podcast. And I'm absolutely thrilled to bits because I'm launching a group membership program on the 1st of May. It's going into a beta trial from the 1st of April. And from the 1st of May, it goes live. The Fabulous Butterfly Club. It's a group coaching program. Looking at those pillars that I use NEST. So it's coaching around nutrition, exercise, sleep, stress, and thoughts and feelings, or mindset. And I'm really thrilled that you put on the spot this morning, asked if you would come and be one of my expert trainers, expert coaches. You're going to help me. You're going to get involved and do some training. Put it that way.
We'll do that.
So it'll be great to have that medical input in there as well. So I'm really excited about that. So I'll put links to that in the show notes as well. Ruth, is there anything else that I haven't asked you that you think I should have asked you, or anything you'd like to share that I haven't given you the opportunity to yet? The floor is yours.
I honestly think we covered pretty much everything there, but all I would say is that if you are struggling with symptoms of anything, Google is a big black hole, and you'll find all sorts of advice and warnings and terrible diagnoses as a result of your symptoms or whatever. But if you are worried about aspects of your health, then it's worth speaking to someone who understands where to go with it. And if you're not getting help from conventional medicine, functional medicine, or lifestyle medicine, which is a simpler approach, may be a good shout. And alongside that, the work that Bev's doing, and that I do to a certain extent with coaching, if you've got all the advice and you know what you're supposed to do, but you're struggling to do it, coaching can really help. Just put you on the right path, help you find your priorities, and set a direction and get some accountability and make real positive changes. So don't feel lost, don't feel afraid about these things. Just go out there, get the information from the experts you need, and if you need some guidance, get a coach. It will make a massive difference.
Very well said. I think a lot of the time it's just taking this big mass of information that we tend to get thrown at us, and having somebody help to break it into bite-sized, sort of small, manageable chunks, so it's not daunting when you're trying to make lifestyle changes now. I mean, I don't know about you, Ruth, but I'm very much in favour of gentle habit change. So implementing small, I call them SOARs, smallest achievable wins. You know, just
Nice.
small little SOARs all the way until they build to better lifestyle habits, rather than trying to do a wholesale of, you know, overhaul of your life, which is just too much for many people. Great advice. Thank you so much. It's been an absolute pleasure, and I'm really looking forward to doing a bit more work with you.
That's fantastic. Thanks for having me on, Ben.
Thanks very much.
Thank you.